Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations with Vicki Soule and guests. Each week, we round up folks that we think have an interesting bit of information that we want to share with you. And this week is no exception, although we have corralled people from our own organization because we do a lot of things in the background that some folks are aware of and other people should be aware of. And so today I welcome Patricia and Danielle, our health navigator and insurance specialist, because one of the things that we pride ourselves on is being cognizant and aware of the things that act as barriers to good health care. And certainly the payment piece is a huge barrier to care for many people. And so we take care of commercial insurances, Medicare, Medicaid. We have a sliding fee scale program so that if you have insurance, but it's got very high deductibles, for example, or if you were on Medicaid and now you're off of Medicaid because of the redetermination that the state is doing, all of a sudden those things loom ahead of us as, oh gosh, that's pretty good information, but I get so confused so easily. So I brought some experts here to talk a little bit about how we as a federally qualified health center go above and beyond what some of our private practitioners are able to do to make care getting easier for you. And so we're going to start today with Patricia, just in terms of you're probably the most well-known among our staff members because you've been with us for a while, and your title is Health Navigator. What does that mean?
As you mentioned before, being TCCH a federal facilitated qualified organization, we offer the services of health navigators. We have one in each facility. Okay. And what we do basically is to help every patient that we get to access any program available. And so we help them to apply depending on their income and the amount of people that is in the household. We help with different kind of applications for state benefits and also for extra insurances for those who don't qualify, like the affordable care.
Okay. And so not to make you feel different, you're very special in that you are bilingual, as is many of our staff members. And so we take all languages, as a matter of fact. How do you deal with someone who might have been referred to us and they speak, I don't know, a Philippine language, or we've gotten some refugees from the Ukraine. How do you deal with folks that come into your office? Because you're basically the first person that helps people with a new appointment, correct?
That's right.
Okay.
It's unbelievable, but even we have so many people from other countries and different languages. Never seems to be a barrier to understand each other when a matter of serving people are. It's amazing. I never really have a problem on 14 years, to understand a patient. There are many ways to understand people. And then we always have our systems in case of, it's not reachable, but they have people that always help them, or we have also some staff people that can speak the language.
And there's a board that has all of the flags so that if you're uncertain what that new language might be, they can point to their flag of origin. And then we have a translation service.
Mm-hmm. That's right, but we always have a good feedback from our other staff before people gets there. And we pretty much are, ready to know where is the country, what is the situation, when did they get here, if they have a sponsor. So it's always an easy way to get them.
That's wonderful to know. And Danielle,
Yes.
you have joined our staff more recently than Patricia.
Yes.
But you have a slightly different role in our organization. Could you explain that?
I do. I actually did start with the wonderful health navigation team. And I did most recently start in the billing department, which is actually, I feel like I've been very fortunate to be able to do, because I not only have seen the health navigation part, but now it's kind of come full circle and I'm on the other end. I feel like we help the patients just as much, just in a little bit of a different way.
It's a very complex situation for any individual.
Yes.
Nothing seems to stay stagnant. And when they have come in perhaps to talk with Patrice or one of the other health navigators, and then they get some care, and then the billing questions start,
Yes.
who do they come to? And I guess that would be
Right.
you first.
Yes. And I have actually had the conversation with health navigators. I feel every day, multiple times, I hear a lot of the girls in billing are answering the phone and they have questions about this balance or how do I pay this bill? And it's, like I said, it's a circle, because then we're sending them right back. Our health navigators can help you. Let's get you on our sliding scale.
Okay.
Those appointments are free. We want to help every patient get on or qualified for some of these programs that we offer.
And so
it's
that's a
ultimately
free
going to
service
benefit
in
them.
every location.
Absolutely. There's, like she said, a health navigator in every location, and those appointments are free.
Okay, so if someone were to call in for an appointment and they've never been with us before, do they have to ask for a health navigation appointment, or how does that happen?
They normally don't know they're going to see a health navigator, of course. So it's always good that a front desk or the call center tell them you're going to see someone to do papers and to get on the discount program. But they normally are saying, oh, you don't have insurance. You are not able to pay for your visit or so. And then, okay, so we have someone that can help you. And they normally tell them you're going to apply for the discount plan.
Okay.
And that's what we introduce ourselves once they are in front of us. They don't forget then that we are the health navigators. They come every year then.
Yeah, because their enrollment for the sliding fee scale discount is an annual enrollment based on the first time they come in to see you, then
right.
360 some days later. So what if they forget, or during COVID they've not been able to come in for whatever reason to renew annually? And so does it lapse? And if they come in for a visit not knowing that, what happens?
It happens very frequently. Even we really emphasize, before they leave, you have to renew this. This is an annual service. And you don't want to have an emergency in the middle of the year. Then you get here and, you don't have a sliding scale active. So we do stress it, but they forget. Of course, everybody forgets. We give little cards. Sometimes we can put it in their schedule, but not always.
Sure.
So we give them the opportunity, if the patient has an emergency visit, they can come see the doctor, and then they have 10 days to see the health navigator and redo and update, their slides. So they don't have to be afraid that, if they come, like it happens with the hospital, I don't want to go because they're going to send me $60,000 bill. No,
right.
It's nothing like that for help, for our health services.
And as things change, so do people's expectations of what might happen. But this program has been around since we incorporated 30 years ago, correct?
That's right. That's right.
What has changed, though, and is constantly changing, seems to be the commercial insurance requirements, as well as what is happening on the Medicaid side from the state funding.
That's right.
Now, federal funding is under Medicare. You don't help people engage with Medicare. That's pretty straightforward on the computer.
Medicare is not something we can touch. Obviously, that's as part of the nation and state individually too. But there is something very, very important that people has to know. Once they start getting Medicare, many people are afraid, and they even deny the Medicare because they have to pay a premium for the Part B Medicare, which is around $164. it's important that you all know that we can help you for that. We can help you to get covered that premium through a state program called Medicare Saving Program.
Okay.
And we also can help our patients to do this so they get waived that payment and they can receive the full Social Security income.
And that's for any visit to our providers.
That's right.
Okay.
Yeah.
Yeah, so that keeps $160-some each in their pocket.
And for people that have very low Social Security, that's a bless. So,
okay.
Yeah.
And that's something that we do try to promote, but I don't think people actually believe it sometimes.
No, they don't believe it. It's too good to be true.
Yeah. And if it sounds too good to be true, it probably isn't what you can depend on. But you can depend on this. That, again, has been in place for many years. And it's a privilege for us to be able to offer that. That is something that is unique to federally qualified health centers.
That's right.
So we often still hear, though, that you're the health department, okay? You're just the same as the health department. Do you agree with that? What do you see as the differences?
My side,
Danielle's over there shaking her head.
We're not the health department.
We do work like the health department in many ways, but I think we are better because there is the public part and there is the private part. I think we are together on that. Like that part of the public service that the health department can give you, we also can give you that, but also that care, that special care that the private, medicine can give you, we also provide that for
So
people.
it's not just for poor people anymore?
No, not at all. Not at all. We have, I'm happy to say we have a lot of patients that they are full pay and they are really happy to come with us because they like our services.
I was surprised when I looked at our annual report and it says that while 51% of people that reported their income have very low income, less than 100% of the federal poverty guidelines, that 33% of our total patients, over 10,000 people, are not reporting their income because they're not mandated to. And that tells me, because I'm one of those, that I'm not reporting my income because I have choices. I have enough income that I have choices. And so what does it matter to statistically to you what that exact amount is? And so that number has gone up every year. And while we are a federal safety net for people who are poor in income, rich in blessings, I hope, by coming to us. So Danielle, I wanted to come back to your role, and we're going to have to take a break. So we're going to put a 2-minute hold. But when we come back, I want to talk about the role that the hospital tax district has with our organization and our patients. Okay?
Perfect.
Great. We'll be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
For those tired of staring at laundry as it piles up, the answer is usually putting it off as long as possible. For most, there's not just another minute to squeeze into a day to get the laundry done. Sunshine Laundries can help. This is Tom Rhodes, owner of Sunshine Laundries, with a reminder that 5 of our locations offer drop-off service. We'll wash, dry, and fold. For locations and hours, we're at sunshinelaundries.com. And with laundromats all along the Treasure Coast.
Is owning a home your goal? With the rising cost of rent, you could be saving a lot of money by owning your own home. At Caliber Home Loans, we can help make home ownership a reality. Meet with us for a free consultation and get on the right path to buy the home of your dreams. For Caliber, home loans is all we do. We use local appraisers and offer a variety of loan options to fit your lifestyle and budget. Call us today, 844-GO-CALIBER, license number CHL15622, Caliber Home Loans, TreasureCoast.com.
Who's got time to clean when you need it clean? Call Germ Wizards LLC. using the most up-to-date equipment. Germ Wizards pay strict attention to detail. They make dust disappear. Whether you need your office to sparkle, your home to shine, or you want to give someone a great gift, hire the Germ Wizards. It's easy to get a quote online. There's even an online portal. To discuss details directly with your cleaning professional, visit germwizardsllc.com. Make dust disappear with Germ Wizards.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health and host of this show. And I'm so delighted to be here week after week because I learn something new every time I have someone in, whether it's another nonprofit, a for-profit company, or one of our own staff members. And today I'm delighted that we have people that are here to talk to us about making healthcare affordable. And that's certainly something that we have had a 30-year history of. We started out in Fellsmere, taking care of migrant and seasonal farm workers, folks that had low income, and ranchers who didn't have a solid crop from year to year, perhaps. But we have grown and expanded. And while we remain a federal safety net, we continue to hire preferentially folks with diverse backgrounds so that we can help people no matter what their socioeconomic status is. And as we have gained a more solid reputation over these years, I'm happy to say that many more are coming to depend on us for that care that keeps our community healthy. Insurance, however, is continuing to be a struggle for many, and we will talk about the marketplace insurance with Patricia in a moment. But before we took a break, I want to say that our sliding fee scale is allowable not necessarily because of the federal funding that we receive. In fact, most of that goes towards our board-certified providers. But we do receive helping hands through our community, and one of those is
the hospital district, the Indian River County Hospital District. It kind of goes hand in hand with our sliding scale. They're together, and that is a free appointment, like I think we mentioned earlier. The hospital district is wonderful. They are there to ensure that our patients, they get the essential care that they need. It's an appointment, just like the sliding scale. And
in fact,
qualify.
They can do both at the same time, right?
You can. We would encourage both at the same time because just like the sliding scale, you have a year. You're qualified for a year. Okay. And then we ask that you come back to renew. So if we can do those at the same time, that's perfect.
Okay.
Yeah.
And that's what allows us to have a nominal, not a mandatory, but a nominal fee donation of $5 because the hospital tax district is supporting the rest of that expense for that individual based on taxes. So what are the qualifications? Can anyone come in and receive a sliding fee scale discount with a hospital tax district?
We encourage all of our patients to come in with their documents, the proof of residence, the proof of income, and then apply with us.
So
we're
the residency is a residency within the county or a citizen?
A resident of Indian River County. Okay. Is what that is, yes.
Okay. So we don't ask about citizenship?
No, ma'am, we do not.
Okay.
And Ms. Vicki, I would like to add something to what Danielle just said about the Indian River District discount. Our sliding scale gives the patient the opportunity to get the medical service, immediately medical service for the basics and in our facilities, TCCH. And then the Indian River District discount expand a little bit more that service. So if the patient needs something urgent to be taken care with a specialist from the district, then that's where the district discount gets in and help the patient for something farther than what we can offer. That's why we had to combine. Program. Exactly.
Okay.
So they help, they open those windows for those other services that are more than the basic ones.
And we know that the hospital district funds a lot of healthcare organizations through the course of the year. So that's sort of a double blessing, isn't it? But while we've emphasized that we need to have folks come back annually to renew, there is a stipulation in there that says, just like for Medicaid or Medicare, if your family size changes, or if you have if you get a new job and you're
blessed with twice as much income as you did 3 months ago, they're supposed to come and report that as well, correct?
Yes, we do.
That's
ask.
right.
Okay.
That's why the health navigator are there to evaluate that patient and figure out if there is any important change. So
Okay.
then maybe we go now for Medicaid instead of, continue with the program we're giving them.
Okay.
Because obviously Medicaid will cover basically, especially for children, full everything, including dental.
So it's not a negative to come back for this free service.
Not at all.
Oftentimes, even though they think it might be a negative, in conversation with you, we can turn it around into a different program or a different opportunity for their health care to continue. I think that's really important, because when I hear, well, you got to come back and tell us if anything's changed, it's like, oh, yes, it did. But do I have to tell you? But truly it can be a great blessing for them. And certainly, if you are making a little bit more money and receiving just a tad less, which I think is really minimal, because our sliding fee scale is pretty generous, then that allows other people to have that, because it's not like we have the federal money tree in our backyard, even though we carry that in the name.
Right.
So that's wonderful. What other types of things do you want to talk about? Medicaid itself and the redetermination, perhaps, quickly?
Yeah, right now it's important people go and see a health navigator because all those changes after the pandemic are important to get updated. Sometimes they think, oh, I'm not going to qualify anymore. But actually, I have noticed with a lot of our patients that after we redo, they even have an increase on food stamps, for example, because they evaluate. Before they were not evaluating every detail, like they were redoing the same application again and again, and now we are going on details because they are putting them on zero. You see, they had to start from zero, and then they realize, oh, the income changed, but also they have another baby, or they move to another place, and then those kind of situations are making there to maybe get more benefits.
Okay. Yeah, that's very important to know and realize. And there's been a lot of chatter within the migrant and seasonal farm worker community about, I don't want to go for health care because that puts me at risk of possible deportation. We have nothing to do with that, correct?
Not at all, no.
Okay.
We have been telling our patients, don't be afraid of coming here. We are not, obligated to do any reports to the state or the government.
And even the hospital won't start reporting until July, and then it's only what I call a nose count. It's not individual information. It's just there were 3 people that came in this month to our emergency room that said they were not naturalized citizens yet.
Yeah, that's right.
Okay.
They just want to know the numbers. They're not going for individuals.
Okay.
Yeah.
I know that it's been very difficult politically, but I want to reassure people that our job is to remove barriers to care, not create more. So feel free to contact any of our staff. How would they do that? How can they best contact you?
Well, first they had to call the number for TCCH. We have one number, so it's very easy, and that connects you with any of our facilities or even any of our providers. Once you're there on the phone, you just have to ask what you want to talk or do, and they will transfer you right away.
And I know that number. It's 257-8224 or 257-TCCH.
That's right.
Okay. So again, we do have an online portal. So if folks want to make an appointment for you, I believe they could do that online or through our website as well. And again, it is free.
Yes.
Free. And are you booked up? Can they get in within the next week or two?
Since we have so many locations, if you don't find in the one closer to you, you can always ask for another one that, I'm pretty sure. I always have at least 2 spots available for everybody.
That's
so I say
wonderful.
send them.
Thank you, gals, so much for being here and clarifying the great mystery of how do I get my health care at an affordable price. I really appreciate it. And I appreciate you being here on the radio, listening to all of this. I hope that you will take advantage of the information that you hear weekly and spread the word as well. And have a great evening.
Thank you, you too.